Thank you, Chair Adams, and thank you all for coming to testify before us. I did want to make a point in response to some of my colleagues on the other side talking about why workers aren't coming back to work. One of the reasons is because they don't feel safe. I mean, they literally don't feel safe and they don't want to put their families at risk. But I want to start by just saying that recently I was unfortunately in the hospital with my husband, and the person who was drawing his blood told him that she had only just gotten her vaccine that morning. And the reason she got her vaccine was because the hospital had a policy that people who work in the hospital have to get the vaccine. And I just want to say how important I think it is that we have these requirements and policies to keep the employees safe, and also, obviously, in healthcare, to keep people like my husband safe, so that he is sure that, and other patients are sure that the people that are treating the patients are actually vaccinated themselves. You know, when she told me that, I was actually horrified first for my loved one, but I also thought about the nurse who told me that she was afraid to hug her children for fear of infecting them. Her employer's policy ensures that of the many hazards posed by their jobs, coworkers aren't one of them. This nurse's story is so common among frontline workers who are terrified of bringing the virus home to family. Ms. Luther, would you agree that some workers welcome vaccine requirements for the protection that it affords them and their families?
Absolutely. In fact, a case in point, we have a pilot group coming back into our office to learn from their hybrid experience. And as a part of that pilot, we have a mandate in place for vaccination. So those people who are participating, but because we also have other people that are in the office that aren't part of this pilot, 6 people out of about just a little under 100 dropped out, some of which, most of which was entirely around not having the assurance that they could be in an environment that was completely vaccinated.
That's exactly right. That's what I'm hearing as well. Though hardline anti-vaccination activists are the voices that often get showcased in media reports about unvaccinated Americans, about 11% are merely vaccine hesitant. They're open to the idea of getting vaccinated, or they would do so if required. In fact, that's the position that the phlebotomist, the person that was drawing blood for my husband, was in. She agreed to do it because it was required. So, Ms. Luther, as Chief Human Resources Officer, what kinds of education and outreach will Columbia Sportswear conduct to address the concerns of the hesitant and to build their trust?
We've been in constant communication with our employees with over 34 discrete email communications, about 10 different styles of posters for our retail and distribution. We have hosted webinars with medical professionals that allows for them to learn medically, as well as the vaccine clinics themselves. We have to balance, make sure we're not over communicating, but we plan also to visit on site. In fact, the CEO and I are currently planning some insight visits to some of the more vaccine hesitant communities so that we can get a firsthand account of what are the barriers. And we have been surveying our employees to get a little color and understand what percentage of our employees continue to be hesitant.
Thank you. You know, the truth is that vaccine requirements work. My home state of Washington is actually proof of that effectiveness. On October 18th, when our Governor Inslee's vaccine policy for state employees went into effect, the vaccination rate of state employees rose to 92%. And that is why I welcome the Biden administration's emergency temporary standards on vaccinations. It is truly a crucial step to get everyone across the finish line of this pandemic and to protect people everywhere, in workplaces, in hospitals, and ultimately to get workers to feel comfortable that they will come back to work and they will be safe because everyone will be vaccinated. So with that, Madam Chair, I yield back. Thank you.